Good morning. We are now live streaming to Facebook. This is Vangela Wade, President and CEO of the Mississippi Center for Justice, coming to you this morning for the first time, our inaugural event, Conversations with Vangela M. Wade. And with me today, I have three of our most prominent Mississippi legislators who I will introduce very shortly. I am going to remind everyone to mute their phones before we commence, or mute their screens, and we will move forward. So again, thanks. I'd like to thank thank our viewers for joining us, as well as my guests. As I mentioned, this is the first of a series of conversations that I plan to have with leaders, with people across Mississippi from all walks of life. And when I speak of leaders, I am speaking of past legendary leaders, our current leaders, and even our future leaders. I also plan to talk with people who, in their own walks of life, are just extraordinary people doing extraordinary things in and outside of Mississippi. Mississippi Center for Justice is a public interest law firm. We are committed to advancing racial, economic, and social justice in Mississippi. Our work is ongoing, and it covers fair housing, healthcare, consumer protection, education, public benefits, and our impact litigation project includes voting and election rights, prisoner rights, criminal justice reforms, reproductive rights, and discrimination. So again, today, I am thrilled to be joined by our Mississippi legislators, who I will introduce alphabetically. First, Senator Briggs Hopson, representing District 23, that's Issaquena, Warren, and Yazoo counties. He's the chair of the Senate Appropriations Committee, member of the Senate Education, Judiciary A, Public Health and Welfare Committees, as well as several other committees. He's served in the legislature since 2008. Welcome, Senator Hopson.
Thank you, Vangela. Let me get off of mute here. Glad to be with you today. Look forward to the conversation.
Thank you so much. Next, we have Representative Robert Johnson, representing District 94, that's Adams, Franklin, and Jefferson County. He is the House Democratic leader. He's also a member of Judiciary A, Military Affairs, Ways and Means, and Gaming Committees, and again, as well as several others. Representative Johnson has served in the House of Representatives since 2004, but he has served in our legislature for a total of about 26 years. He served in the Senate from 1993 to 2003. Welcome, Representative Johnson.
Thank you for having me, Vangela. It's an honor to be here, and as everybody on this call knows, I love talking to these guys. They just have to get me to be quiet for a second, so we'll have a good time.
Well, we're going to have a good time, and as I mentioned, we were in the waiting room together, and that is very interesting to be in virtual waiting room. I mentioned to Senator Johnson, who I've known for quite a while now, that this was my first live streaming event, and I was going to lean on my esteemed guests quite a bit. And so he assured me that they wouldn't have any problems carrying the show. So we're looking forward. Now, last but not least, let me introduce Senator Derrick Simmons. Senator Simmons represents District 12, which includes Bolivar County, Coahoma, Washington County, and he is the Senate Minority Leader, Chair of the Senate Enrolled Bills Committee, Vice Chair of the Constitution Committee, and member of the Corrections, Insurance, and Judiciary A Committees. And he has served in the legislature since 2011. Welcome, Senator Simmons. Take your mute, remove your mute.
Thanks for having me, Vangela, and I look forward to the conversation.
Thank you. And I must say, when I extended the invitation to the legislators, even though they come through very difficult session, not only with the legislation, but just working through these issues with COVID. They were all very gracious to share their time with me. So again, I am very thankful. So what I will say before moving forward, of course, is that the three of you, along, I know that you had a host of other leaders, legislators who played key roles in the process for bringing down or retiring our former Mississippi flag, which displayed the Confederate emblem for over a century. And many people associated that flag with violence, racism, systemic racism, and just division within our state. So thanks to your work and the work of your colleagues, we will no longer be represented by that flag, by that symbol, and we all look forward to seeing the results of the committee with developing the options for a new flag. So again, thank you for that. So in today's conversation, I want to, we're going to talk a little bit about the behind the scenes of working through the process of getting to the vote on the flag, but we're also going to talk about the challenges that the state is undergoing with COVID-19. And I want to, as we end our time together, I want to hear about your visions for Mississippi going forward. So first, let's jump right into the topic that's on everybody's mind and has been. I know it's been on my mind since around about March, when my office, Mississippi Center for Justice, and many other organizations, businesses started working remotely as a result of trying to protect ourselves from the COVID-19 virus. So we know that the number of cases and the deaths are rising in Mississippi. One of the things that hit me this weekend was that after hearing from Dr. Ashish Jha, who's director of the Harvard Global Health Institute, having tweeted on Sunday, I believe, and I quote, "One state doing very badly but has received little attention is Mississippi. Mississippi has the second highest number of new cases per capita, just behind Florida. But Mississippi is going up while Florida is going down." Now that tweet went viral and it was carried by many of major news outlets. And so once again, Mississippi was receiving national attention for all the wrong reasons. So at my last view of the Department of Health's website, we were at over 60,000 cases of COVID in Mississippi, with over 1,700 unfortunate deaths, and most of them African American. So Representative Johnson, we'll go to you first. What's your take on the latest information regarding COVID, and how do you feel about Mississippi being at the top of the worst list once again?
Well, I don't find it shocking. I mean, we always manage to get the wrong kind of attention. But some scientists from Harvard telling us that we're probably in the worst shape. I mean, it's not a revelation. We have some of the worst health outcomes of any state in the nation. We have the lowest per capita doctor to patient ratio of any state in the nation. We have not done our job in doing what we have to do to fund healthcare in the way that we should here in this state. And when you consider African Americans, there's a multiplier when you talk about healthcare, because you have African Americans who live up and down the river along the Delta, places where you don't, and I include places like Natchez and Vicksburg as part of the Delta. I mean, I consider all those river towns and anything west of I-55. And what happens is there has not been the kind of attention and investment in that area of the state on any level, whether it's business, whether it's jobs, whether it's healthcare, whether it's education. We just hadn't done everything we need to do. Vicksburg is a little bit of an exception. They have the Corps of Engineers there, they have other things, but they still would be doing better if we had paid the kind of attention that we need to pay in that area. So when I hear that, it doesn't surprise me. The other thing that concerns me is if you want to see a microcosm of what's happening in the state, all you have to do is go to the Mississippi State Legislature. We were a laboratory for everything that you shouldn't do, or everything that we weren't doing right in terms of dealing with this virus. When we got back in March and then we left and came back, I remember saying to the speaker, I said, Mr. Speaker, I know you don't want to mandate people wearing masks, but please tell me why legislators refuse to voluntarily protect themselves, protect people around them. And he shrugged his shoulders and said, I really don't know. But when Dr. Dobbs came out and said that people should wear masks, we had more people began to wear them, but there was just there were people 70% of the people walking around the legislature would never put on a mask. And so you end up with a legislature the numbers were around somewhere in the 90s, but I think there were more people sick at the legislature than people acknowledge. And so that's the problem statewide. The problem I see is that, and I see this nationally too, there needs to be a hard decision made about what we need to do. There need to be masks, for instance, with schools going back. I think Ms. Woodward is right. We shouldn't have school, at least delay it until after Labor Day. Just some strong constructs in place to try to at least get yourself together to deal with what you have ahead of us. And I don't want to put all the blame on the governor, but some of this, the governor just could have he's trying to balance and try to keep everybody. This is not a time to keep everybody happy. This is a time to make a hard decision. And the hard decision should have been made a couple of months ago that, look, we're going to shut certain businesses down. We're going to mandate everybody wear a mask, and we're going to protect ourselves. The same thing he's saying now, we need to do it, and we need to do it very emphatically. And that's the problem I see. I include myself in that. Leaders who are not willing to go forward and say, this is what we have to do. And we need to do those things.
And I'm going to pivot to Senator Hopson, just to pick up from where you left off, Representative Johnson, particularly as you talk about not only the governor, but even legislators balancing those various interests, whether it's healthcare balanced against the economy, or even party interests. So Senator Hopson, if you could just pick up on that and let us know what your thoughts are with regards to where we are with COVID.
Sure, Vangela, thank you. That's a good segue, because I think the things that have been on my mind the last few days particularly, but really over a week or two, have been trying to balance three primary things that I'm looking at. One is just overall health care and health overall for the state of Mississippi, and how this virus is affecting us in our health and in some cases, lives. I think there's no question that what Representative Johnson said earlier, that Mississippi's always been on the lower end of health outcomes. Our people are not as healthy as other states. We've got more instances of hypertension and diabetes and other diseases that make you more susceptible to having a bad outcome if you get the coronavirus. So that's certainly the start with that concern. But I think the other two issues that we need to weigh in there are education, because we're about to start schools back, and the economy. And it's all very important. And look, I've been doing this. I represent 2 school districts as an attorney, and I've seen a bunch of different plans for starting school back, and virtual and delaying start and hybrid and AB days and all these different things. And I'm not going to criticize anyone for their efforts to try to make schools as safe as possible, understanding that we've got to get back to some form of education, whether it's virtual, whether it's live. I think no question that we're better off if we can get back in regular school settings for our kids and for our families. And that kind of plays into the economic part too, because as kids, the difficulty I think we're going to see in having a non-traditional or virtual settings is that you're going to have some families that aren't going to be able to go back to work. And there's a negative there too. You look at job losses, then you look at a company or a plant shutting down because they don't have any ability to earn a living for their company or for their employees. Back in April, we had a roughly $240 million hit to our economy in Mississippi when things were kind of shut down. And I look at it, and let me put on my appropriations hat for just a minute. I look at this and say, you know what? If we take a couple of $250 million hits in months, that's going to be devastating for our schools, for our health, for the Department of Health, and overall health in the state. It's going to be devastating for public safety, for corrections, for any number of things that we support at the state level. And so recognizing that health is certainly a key part of all these discussions. And by the way, I am pleased to see, of course, I know if we get back in schools, that's liable to spike up some too. I think that's a natural response, but we dropped from 1,700 new cases just a few days ago down to 500 and something cases yesterday. So even though when the report that you got from the Harvard director was that we were on the wrong tier, we had a precipitous decline here in the last few days of new cases. In fact, I had to reread the paper that I saw when I said 500 and something cases yesterday. I said, whoa, did they leave off a one at the beginning of that? Or, I was thinking 1,500. But I'm not saying that we're out of the woods, because we're not. There's a lot of work to be done. But I think we need to balance all these things together. And they're tough decisions. I'm not here to criticize anybody, because nobody's got a playbook for what we're going through right now.
Right. These are certainly unprecedented times in many ways, as you both mentioned, Representative Johnson and Senator Hopson, that the health outcomes in our state is really pretty terrible. Just the base word is horrific, and particularly for African Americans and poor people across this state. The other day I was reading where before COVID, more than 40% of people between the age, I believe, 19 and 65 were without insurance in our state. So as I go to Senator Simmons, I'd like to talk about, or I'd like to hear you talk about, Senator Simmons, just exactly what is the issue with Mississippi and healthcare? Why haven't we expanded or extended Medicaid? And then I think it's even more important, since looking at the numbers of COVID cases and deaths in you all's counties, particularly in yours, Senator Simmons, and in yours, Senator Hopson, with Warren and Yazoo counties cases being extremely high, as well as, of course, Bolivar, Coahoma, and Washington. So if you could speak to, again, just a dire sense of the dire issue of not having adequate health care, or most Mississippi, particularly African Americans, not having health care and being more susceptible to COVID as a result of the underlying healthcare issues. So it's circular, but certainly does the state not have some responsibility in making sure that the people are indeed at least having baseline insurance? Senator Simmons.
Thank you so much, Vangela, for having me. And I really echo the remarks that were made by Leader Johnson and also Chairman Hopson as it relates to how it is important at this time that we try to balance health as well as economics, and how at this time more than now we need bold and courageous leadership to make the tough decisions, whether it's mandatory masks, whether it's delaying school. It's just not time to play politics. We need bold and courageous leadership. If not, Mississippians will continue to contract this virus, and Mississippians, unfortunately, will continue to die. But Vangela, I will say that I have not been in the legislature as long as Leader Johnson and Chairman Hopson, but I will say in my short 8 to 9 years in the Mississippi legislature, the single most failure that I see is our failure to expand the Affordable Care Act and to expand healthcare access to over 300,000 Mississippians. These are working Mississippians, and we could have actually generated about $1 billion, or we've lost $1 billion a year in the state of Mississippi, and we've also lost the opportunity to create about 9,000 new healthcare jobs. So even now, with what we are dealing with, the healthcare system would not be so overwhelmed if we would have taken the advantages of the Affordable Care Act. And so I will say that to the extent that the legislative wheel is moving in a direction that's where we need to go, I would say that we need to do it, I mean, like yesterday. It's so important that we expand access to healthcare. And a lot of the failures, a lot of the outcomes that we are seeing, I strongly believe will not be as severe if we were taking advantage of the Affordable Care Act.
Thank you. And if I could, I'm going to pivot to Representative Johnson to get your take on expanding the Affordable Health Care Act.
Look, thank you, Vangela. Derrick is exactly right. And I deferred to Derrick because Derrick's been working on this COVID issue a lot more intensely than I have. But now that he's opened that door and I know where he stands on it, because I want to be on the same page. Look, the Affordable Care Act, I remember being on appropriations in 2015, and the interim CEO of University Medical Center came to the Appropriations Committee meeting and said, look, you may not politically like the Affordable Care Act, you may not want it, but we have it. If we don't involve it, our money is going to go somewhere else. And I'm going to tell you that the University Medical Center is it's going to be a $52 million a year hit to us because of the way the system is in place. Then we're a public hospital. This is what it's going to do to hurt us. But the other important thing about that, the 300,000 people who are not covered, and you talk about African Americans being adversely affected, and the idea that we also have these underlying medical conditions that is all born out of poverty and a systemic and a repetitive social condition that has been perpetuated by racism, segregation, whatever you want to call it. It's been there for a long time. But it also means that when you look at Vicksburg, Warren County, Yazoo County, Adams County, LaFleur County, all these counties that I talked about, these are frontline working people. These are people whose jobs are in grocery stores, who are going to work every day without health coverage. They're working in public service or public jobs where they may be checking meters. They're doing all the kind of things that you don't shut them down. They have to go to work. And in most cases, we found out early on that in some of these employers, not because they didn't want to, but were not in a position to provide the kind of protection because they didn't have the resources that they needed. And one of the things we worked on earlier was, what can we do to get the resources to employers so that they can protect their frontline workers? Senator Hopson was in some of those meetings. He knows that those are the kind of things we have to consider. Other states may not have to, but in Mississippi, we got to think about when we get a $1.25 billion hit from a gift from the federal government. One of the first things we have to think about is, okay, how do we help employers make sure they keep workers safe? And so when you see those numbers spike in the African American community, you look at where we're working and look what kind of jobs we have: service jobs, jobs with people. I mean, the casinos are open and full. A lot of us are working in casinos, and they cannot be a safe place, but they have to be open, so to speak, because it's a big part of our economy. And all I'm saying, and I want to go back to something Senator Hopson said, I'm not criticized. I don't want my assertions to be formed in a way of criticism. I'm just saying it's difficult. I don't fault anybody for having difficult decisions, and I'm not saying don't open schools, but if I'm the governor, or if I'm a leader, I want to put all of the experts, the educators in the room. So now tell me, not individually where your district is, I want to get as many educational leaders in the room and say, tell me what you think we ought to do. And every one of them have said, we're not ready. Give us a little time. Healthcare experts have said, look, you got to do something. We have to have some mandates in place because we're getting overwhelmed. It's like nobody's listening to the people who know. I'm a lawyer. Don't know much. The little I know about law, I know, but don't know a whole lot about education and healthcare. I got to talk to somebody who knows. And I don't see that happening. The governor said he read a 598-page document with notes. Save the documents. Put your experts in a room, find out what we need to do, and do that. And so when you talk about healthcare, the Affordable Care Act, we would be in the third year of 100% funding right now if we've accepted the money. The only reason we didn't accept it because it had a Black president's name in front of it. That is the only reason. And I hate to say that, but I've heard it and I keep hearing it, and I know that's it. This state has never turned down anything with $1 billion in front of it. We turned down billions of dollars in healthcare money, an opportunity to create jobs that would have averaged $60,000 a year, 9,000 of them, because it said it was called Obamacare. So I'm just telling you that it's time for us to take responsibility, do what's best for the citizens of the state of Mississippi, and we have an opportunity to do that, and I think that's what we ought to do.
Just to sort of take this out, to extend it and give Senator Hopson an opportunity to respond or to give his input. And again, I agree. We're not here to it's not easy decisions that any of you all are called to make. But certainly we see that time and time again, the citizens of Mississippi seem to be in a constant, I guess, downward spiral when it comes to any of the major indices, whether it's education, healthcare, wage, technology. We're always at the bottom or the top of the worst list. So Senator Hopson, with the opportunity being there to have support for at least healthcare for our folks in Mississippi, again, in the two of the counties that you represent are being heavily devastated by COVID, and we know that as schools open up, that the numbers are more likely to increase, as we're seeing from some of our what's going on in some of our sister states. But for instance, like Georgia, that attempted to open even over in Gwinnett County and ended up having to shutter once again. So if you could speak to that, just with regards to our healthcare, with extending it, and with how do we start balancing some of these real issues that people are feeling every day with moving our state forward.
Yeah, you loaded me up with a lot there, Vangela. Let me first start off by saying, and Representative Johnson knows I was not being critical of the comments, and certainly not insinuating in any way that being critical of other people. I guess on that point, I think what I realized, because I have been involved at this with this issue of, particularly in the education setting, I have been involved with a lot of different people around the state on school start, and I have heard and seen a jillion different opinions, it seems, and this is hard. I'm going to go back to that state. There's no playbook for what we're going through right now. This is a difficult time, and we're seeing it on the national level. We see it certainly at the state level too. There are a lot of things happening right now that are so unique that nobody's got the right answer to. I've gone back and said to myself, what if we wouldn't have flattened the curve back in April? Would we have maybe spiked up then and maybe be on the downslide? Maybe not. Maybe it would have been so devastating that we would be in a terrible situation. Now, I don't know, because we don't have the ability to see ahead, but I hope that most of these people are making good decisions based on data and good information they have in front of them. With respect to the counties that I represent, actually, I don't think any of the three, unless something's changed in the last short 24 hours or so, I don't think any of them are on the quote unquote hot list, if you will, right now for counties. I think between the three of them, they're under 40 deaths between my three counties. That's not good. One death is too many, but it's certainly well below a lot of our counties and places in the state. I know Warren County's been supposedly teetering on the edge of getting on the hot list, and I'm calling it a hot list, but what I'm referencing. So there are certainly issues there. I don't think we've gotten to the point in my counties where we've got a run on beds or a run on ICU. But you don't want to get to that point. That's a bad place to be when you don't have the facilities to take care of the people that are ill. I think with respect to healthcare overall, it's always like everything else. It's always a balancing issue of the funds that are available. We've got some good. What we don't have enough of in Mississippi, I think, is rural healthcare, and all three of us represent some rural areas.
I think some folks would say would say that we have a number of healthcare deserts
yes.
That's particularly on the west side of our state.
I would agree with that. We need more healthcare on our side of the state. Some of that is, I think, a choice. We do have some federally qualified health centers on our side of the state. We do have some other community type health centers that do some good work. But when you see the numbers of people and you see the lack, what's really hard, and I've been watching this over the years, it's really hard to attract the physicians and the nurse practitioners and others into some of these areas. It's really common and similar to education. I think one of the things that all three of us struggle with in our areas is it's becoming harder and harder to attract healthcare professionals and educators into our areas. And I think that's where you're going to see the big change that I think is taking place. And maybe this coronavirus has helped move us along a little quicker, and that is telehealth and teleeducation. Those are two things that we're going to have to, in Mississippi, one of the ways that we can get ahead, and you referenced some of the areas where we're behind. One of the ways I think we can catch up in some areas are through a really good, robust teleeducation and telehealth system to start taking care of some of these things, because it's become so hard. I say in the education setting, you know, when you can have, we've offered incentives, and I think Representative Johnson and Senator Simmons can tell you the same in some of the counties I represent, where you get a bonus to come to the counties that we represent to teach, and you still can't get certified teachers to come there. It's very frustrating. But maybe we can have a teacher that wants to be in Jackson or wants to be in DeSoto County or on the coast or Hattiesburg, Meridian, et cetera, where they can teach a class to our students in our districts and offer the same level of education. And telehealth is kind of the same way too. Maybe we've got a way of seeing some of these patients over the phone, just kind of like we're doing right now. I watched my dad go through this, and I'll be quiet in a second, but I watched my dad about a year ago when he had to go to the emergency room, and here in Vicksburg, and so good emergency room, good hospital, physicians around, but they actually pulled a camera up next to his bed, and he sat there and and I was in the room, talked to a doctor in Houston, Texas, who was actually going through the numbers of his, blood work and his EKG, et cetera, and did the entire process right there. It was pretty fascinating to watch. And I think this is maybe the future of healthcare and the future of education in a lot of ways in our state.
And Senator Simmons, I'll direct this to you as sort of a follow-up or segue from our healthcare issues, which Senator Hopson just brought up, having access to telehealth and teleeducation. But what about the whole issue of broadband or access to these resources? So even if the option or the possibility is there, where do we stand? And particularly in those areas that on the west side of our state and any other area where there's very little access to sufficient internet broadband to even host a virtual, whether it's education or telehealth. So if you could speak to that.
Yeah, and before I speak to that, Vangela, let me just respond to what Senator Hopson said. I think it's great. And we have seen proposals in the legislature regarding telehealth and the way that we should actually do things electronically now. And now even this Facebook Live, we all in various locations, and we actually having a conversation. So I think that certainly it's the way that we are headed and the way we are going. But in areas that I represent, in areas that's west of 55, the issue still becomes when you have a robust telehealth program, the economic engines in a lot of our actually healthcare deserts or the rural parts of the state is to have a healthcare provider or a doctor or a healthcare clinic in those parts of the states, because it actually help the economics of those states. And so even though I recognize that telehealth and maybe teleeducation is the way to go, I am a little concerned about would it further depress those areas by doctors not even wanting to come, because then they can actually take advantage of telehealth and teleeducation. And so with the rural broadband piece that you spoke of, I mean, it's a positive correlation with our depressed or our areas of the state that are suffering the worst, whether it's education, whether it's healthcare. They are also suffering regarding broadband and internet access. So the question would be, even though it's a great idea, what type of investment are we willing to place in those areas of the state, like Representative Johnson said, that we have neglected and we don't make the investment in, and we have not made the investment in such a long time. So the question is, for any proposal that we would like to see be successful and that would actually raise Mississippi from the bottom and a lot of these outcomes, are we willing to make the tough decisions legislatively and executively to actually invest in those areas? And not until we do that will we get a return on that investment.
Thank you. And look, I'm going to go to a question we've received from some of our Facebook viewers that sort of feed right into this current discussion. What support system, resources, funding are currently available for working parents who may have students at home taking online classes? And if you could pick up with that, Senator Simmons.
And what's the last part of the question again, Vangela? I'm sorry.
They're asking what type of resources or funding are available for parents who have students at home taking online classes with regards to K through 12. What resources are there any for parents? As you all mentioned earlier, you got to go out and work. These are what people call, when they were talking about frontline essential workers, initially it was only healthcare, but we know that the people at the grocery store, we know the people who are making deliveries, we know the people who are working in custodial care, people who are out there on the front line, usually more likely with the lowest wages. Those are the people who got to continue to work. Those are the people that we represent at MCJ who are facing losing homes or being evicted because they can't pay their rent. So they've got to go to work. So what about those people who are trying to educate their children? Are there resources available? Are there any resources through the CARES Act available to help these parents who are going to have their students at home?
At this time, there are not any resources. And I don't know if Leader Johnson or Chairman Hopson, if either one of them want to jump in, but I can't think of any resources available.
Well, we don't have a program in place, but I would suggest that we do have resources. We still have a great deal of the $1.25 billion in the CARES Act available to do whatever we like to do. And we, Senator Hopson was in the room, and we have had some discussions about those kind of issues. The problem is just, again, going back to making those hard decisions. And Derrick said it right. It's about making an investment. We're doing this again. I mean, I think Senator Hopson talked about telehealth. I thought all those are great programs. But how can you talk about telehealth in rural communities? They don't have broadband. How can you talk about virtual learning in schools? Somebody gave an example, for instance, Hinds County Public Schools have given all of their students iPads. But those who live in Edwards and in South Hinds County and really in rural parts of Terry, they got an iPad, but they don't have the internet. So you got part of this student population in the same district who can't use equipment that they have. So what good is it? Again, this is not about. I know people need to go back to school. Kids need to be in school, but that's an excellent question. So if kids need to be in school and you have a program of virtual learning, have you done something to make it possible and provide support for parents who may not have the resources for their kids to do the virtual learning or while they're at home? And have we have a plan in place? Have we taken the time to do that? That's my only suggestion about why are we rushing back? Why don't we take the time? And Senator Hopson, I don't disagree with him. There is no perfect plan, but time is a perfect plan in terms of taking the time to understand what it is you have to do. That question right there tells me we are not in session right now. But if we were going back in session tomorrow, that's something I'd say, look, how much money do we have left? Can we get a program to support parents whose kids are at home in virtual learning? So there are things we can do that we just haven't taken advantage of. But that is something that at least we talked about. We talked about hazard pay for frontline workers. We talked about it, but we didn't get past the point of actually funding it. We had these intimate meetings where leaders would sit in the room, Senator Hopson, Senator Simmons, and we actually talked about it for a brief moment, and then we left it alone. But those people need to have incentivized pay. They need to have extra pay for that kind of support that they may need. We could do those kind of things. And so what I can tell you, though, what I'm encouraged by is when I sit in a room, no matter what party you're from, with Senator Hopson and other people, the first thing everybody's thinking about first is how do we help people? And that goes across party lines. And when you can sit down and focus on the problem and figure out the most important thing we can do is how do we protect the people we represent, then we can do that. But but for the fact that people needed to get home and get back to work, and we're beginning to get people sick at the legislature. We need to be there now working on this problem, especially before kids go back to school. But no, there's nothing in place But I would argue that we got resources that we need to spend before December 31st, that we need to take advantage of some of those and see if we can do something to do exactly with that question, to answer that question and support parents who are frontline workers and kids who will be doing virtual learning and be at school.
Thank you, Representative Johnson. And I would ask, not being too well versed in the process of the legislative calendar, but when you have a situation that, as people are using this word, ongoing, I hear it 100 times a day, and I'm beginning to use it as many times myself, unprecedented times requiring extraordinary measures. How do we, knowing that we have these holes in our, that our populations are walking into, because we know that if you're already at the bottom, when you lose income, when you lose resources, there's only one place for you to go, and that's further to the bottom with a harder crawl up. So why aren't we seeing the legislature, and maybe you all are, but are you planning a special session?
We didn't adjourn, so we can come back anytime we get ready. And I would argue that I think everybody would agree, we have taken extraordinary measures. We have done things that I don't know that we've ever done them before, but if not, they've only been rarely. So we've suspended the rules to take extraordinary measures. We have put ourselves in a position to take extraordinary efforts if we have to. I'm just arguing that we're not there now, but we got between now and October 10th to come back in there and do whatever we can do. But we have taken extraordinary measures, and I think we're prepared to do that. I think Senator Hopson and Senator Simmons would agree. We are prepared to we have put ourselves in a position to take the most extraordinary measures. We just got to do it.
Right.
But let me just clarify one thing there. We've got about 6 days left, if I remember, that I think we've got available on the calendar, and it's got to be related to some federal funding. There may be some other technical aspects that could be included, but I think that's very slim. I think the window's pretty there's only so much room to go in on what we could do when we go back in. But yeah, I mean, no question, we got unprecedented times. This whole session.
But yeah, Senator Hopson, we have unprecedented times. If you remember the resolution we sent over, we didn't have those kind of restrictions in it. And so those restrictions for 6 days was a suggestion made by the Senate. But it's still, we still have until October the 10th to work within those 6 days. But to the extent that we have taken extraordinary measures to do what we've done, we can come back to suspend the rules and get rid of those 6 days and go to work and take as much time as we want to. We can still do that because we're in unprecedented times. So we put restrictions on ourselves, but we can take those restrictions off anytime we get ready. I mean, if we agree.
There's some.
There probably is not. That. Yeah, that's probably not the will to do it right now, but if we could, if we wanted to.
Well, I tell you what, that we know that the federal unemployment insurance benefit, I believe it lapsed on Friday. The Mississippi unemployment benefits are even in normal times, I think they may range from $35 a week, maybe up to $225 or so a week. But without the federal unemployment benefit, that additional subsidy, tell me, in your mind, how do you see Mississippians who are unemployed, out of work, and even if they wanted to go to work because of COVID, they're not able to go to work? What do you see their options being? What would you tell those families right now?
Well, Senator Hopson is the chairman of appropriations. He can tell us how much money we put into employment security.
Well,
whether or not we're going to put any more in there.
Let me say this, Vangela. First of all, my two colleagues here on the phone call were instrumental, along with myself and a couple others, in getting the Back to Business Act, a grant program set up for a lot of people, small businesses, to help them out financially. Second thing is, as Representative Johnson alluded to, there are some other programs out there that deal with some of the issues we're talking about. When I said earlier about telehealth and teleeducation, and I said one of the benefits of the CARES Act funding, I think what I was getting to was we actually finally have some money that we're going to put towards broadband expansion, so we can educate, so we can do telehealth and those kind of things. So granted, I agree with Representative Johnson that right now there are some places that you can't do that at this very moment. I'm hopeful that in the very near future, with the expansion of broadband in Mississippi, we'll be able to do a lot of different things. But back to your point on the funding, I mean, the Emergency Paid Sick Leave Act and the FFCRA, Families First Coronavirus Relief Act, and the Emergency Family Medical Leave Act are all federal programs that deal with the exceptional instances where you've got to take off either because of you got coronavirus in your family or because a child care is unavailable for your child, and there are protections for your job. Certainly there could be some financial issues because at some point it's depending on which category you fall in, whether you get full pay or 2/3 pay, and then it's a certain time frame for what you can get on FMLA. And that would be a whole nother discussion for a few more hours if we got into that. But the bottom line is the sooner we can get back in school in a traditional setting in a healthy way. And I want to be real clear about that, where it's not unhealthy. Spacing, mask, all the things that may be necessary to make it healthy. That's going to help keep people from having to make that choice of, do I stay at home with my child or do I go back to work? So those are tough questions to be dealt with.
Right, and I think it's even tougher. And Senator Simmons, if you could step in here and just also address what happens when particularly the families in your district no longer have access to the 600 additional federal funding to cover their just immediate needs to cover rent. And I'll say this before you address that issue, that here at Mississippi Center for Justice, we've had to work with families, people calling under threat of eviction, mainly because they have no way of paying the rent. And in some instances, landlords are refusing to make repairs or are trying to immediately evict people, even though we're under restrictions with regards to, maybe not a shelter in place, but certainly where do you go in the midst of a pandemic? Do you become homeless because you can't pay your rent? So if you could speak to not having sufficient income and not having resources from the state to provide for just basic, decent human needs.
In parts of the state like mine, where people were using that money to catch up, or they were able to actually pay their rents, or just basic utilities and to take care of their families, the question becomes, will they be able to do those things going forward? They were already struggling before COVID-19 hit. So a lot of people say, while we're dealing with the COVID-19 pandemic, people were experiencing economic pandemics and all of the racial injustices that we see in the state of Mississippi and in my part of the state. They were already hit with that before COVID-19 hit. And when COVID-19 hit, it just made their lives even more difficult. And so that federal additional allotment helped them. And now that it is no longer there, they'll actually revert back to the struggling lifestyles that they had, trying to make ends meet and trying to take care of their families until we can do something to get them the assistance they need. So I am really, really concerned.
Let us touch bases just very briefly on, I understand that through the CARES Act, that for, I believe, when we were talking about the unemployment, there was $182 million to replenish the unemployment insurance trust fund. Could one of you speak to that, Representative Johnson, with regards to how does that impact the availability of funds for people in their homes?
Well, there is that money. There's unemployment money available to people or businesses, and for people who are unemployed. That 182 million was supposed to shore up, give employers some relief. We were sort of the backup. They pay a certain fee into it to fund the employment security, the unemployment funds that people receive. Businesses pay into that, and they have a certain fee after a certain amount of money runs out. They actually asked for $500 million of the 1.25 billion that we got, saying that by the end of the year that the economy would be so bad that in order for them to provide money for unemployment, they needed help for us to fund that. So theoretically, us giving them 182 million should help the employment security and people get unemployment check, but it still is not enough to pay bills and do the kind of things that we need to do. And so it is frustrating that we are very sensitive to people who give large campaign contributions, and we will be more than willing to open up our coffers and say, look, we're going to fund you, we're going to give you the money you need, we want you to stay in business. But there are people here trying to go to work every day who may not be able to pay rent, or who may not, they want to go to work, but you say for instance, now the city of Jackson, rightly so, said bars can't be open. Well, that's somebody's job. And so they can't go to work. What are they going to do? We need to be prepared to help those people. It's like they don't exist, like we forget about them. And that's what I was saying to Senator Hopson. Yeah, we've only allowed ourselves 6 days to come back and deal with the CARES Act, but that's because we chose to only allow ourselves 6 days. We chose to limit what we could work on. We have the rest of the year, if we want to come back and work on issues that affect people, because we are in an extraordinary time, and we can choose to do that if we want to. But it's funny when you talk about working people and poor people. When you ask, well, what can we do? You can give them more money. If you want more teachers to go to rural areas, you say you incentivize them. Well, you're not incentivizing them enough. You want doctors to come. Maybe you need to double what you pay doctors in order for them to come. If you have strangled a community, a region of the state, to the extent that nobody wants to be there, you then can't turn around and say, well, I don't know why anybody doesn't want to go there. When we do economic development in the state of Mississippi, Derrick can tell you this, we have to fight to say, why are you not looking at the Delta? Why are you not looking at Southwest Mississippi? Oh, well, their school systems are not that good. Oh, their roads are not that good. Well, they can't be good if you have never, ever, the state has refused to put money, the state, whose responsibility it is to fund it, has refused for almost 100 years to fund them at the level you funded other places. And so if you want to know how to fix it, give me some money. Give me some money, we can fix it. And so you can't talk about broadband, we're going to invest in broadband. Well, you wouldn't have to worry about it if you had companies and economic development and a tax base in those areas. You'd have it. So if you don't have it now, you have to ramp. It has to be a multiplier involved if you're going to help the people in the Delta and rural areas. Let's do that.
I will ask you this as you're about to, and then we'll pivot to Senator Simmons. But since you're en route to your meeting, I want to catch you on the end and get your last input. The legislature, and this is a question from Facebook, the legislature appropriated $80 million to hospitals and $49 million to other healthcare organizations. How do you expect this will be used to improve our ICU, ventilator, and basic PPE in these facilities? And how soon does this money hit the ground? Senator Hopson.
I think I heard your question about getting funds for PPE, et cetera. And if that, is that the question, Vangela?
Yeah, yes, the legislature appropriated $80 million to hospitals and $49 million to other healthcare organizations. How do you expect this will be used to improve our ICU, ventilator, and basic PPE in these facilities? And how soon will this money hit the ground?
Well, it's already out there with the agencies. Now, some of them are going through some details of making sure they get the products and get the money out in the proper way, because you need to make sure, because all this will be audited eventually by the federal government to make sure it was spent properly. So we have to make sure that's done correctly. But we also have money going to MEMA as well. There's some matching issues. I could spend a lot of time talking about that. Some matching issues with federal funds on some of the MEMA distributions of PPE, and that's important to realize. And then, again, we could.
Thank you so much, Senator Hopson.
Thank you.
Appreciate you and appreciate your time. We will continue for the next few minutes with Representative Robert Johnson and Senator Derrick Simmons, and I want to ask you about the flag process. I know it's been a few few days, a few weeks now, and there was a lot of excitement around the legislatures being able to come across party lines, and people who you wouldn't have thought would have supported the flag being retired. You saw that support. You also saw support across the state, let alone the nation, but more importantly across the state from various interests. Senator Simmons, could you tell me just, if you can just sort of take us behind the scene as you saw this unfolding in the last few days, and just sort of lead us to that moment when you realized that history was about to be made? I'm sorry, Senator Simmons, we didn't hear you. If you could.
Can you hear me now?
Yes.
Yep, Vangela, thank you so much for the question. I just want to first echo what Leader Johnson said earlier, was just about the fact that Democrats and Republicans, we came together early on in the session, and one of the first pieces of major legislation we worked on was helping our small businesses, which are the heartbeats of our communities and how they've been affected by the pandemic. And so out of that $1.25 billion, we were able to do a small business program for $300 million, which represented about 25% of that. But the point I'm making is, in the same bipartisan way that we work together to help small businesses rebound from this pandemic, it's the same bipartisanship that we witnessed as we worked on the flag. And so, I mean, the momentum or the stage had been set, so to speak. And so after the unfortunate murder of George Floyd, and we saw all these global protests, and we saw one of the largest protests in the state of Mississippi since the civil rights era. And we saw all of the outside voices just telling Mississippi to do the right thing. Well, you had inside voices in the Capitol, and it was a bipartisan voice that it was time for us to do the right thing. And then when we had the NCAA and all of our sports associations, our Black and white ministers, the business community, it was like a chorus of everyone singing the same song, that it's time for Mississippi to do the right thing regarding this flag. And so just to be part in the process of talking to Democratic colleagues in the House and the Senate, talking to Leader Johnson on the House side, and his vote count in the House, and me telling him, well, you got the votes, Robert, we don't have the votes in the Senate. Me talking to my Republican colleagues on the House side and the Senate side, talking to leadership, being able to have an open door policy that Lieutenant Governor Derrick Simmons had, to allow even Democratic senators to just walk into his office and to talk to him. That's new. It's a new day at the Capitol regarding on the Senate side anyway. And so all of that just played a part in this historic step in removing the flag. And I know Leader Johnson is going to jump in and tell you his side of it.
Right, because I want to know how did that come about? I mean, did you people often talk about smoke-filled rooms, and I did a brief stint of lobbying up at the Capitol in another life. I don't remember seeing any smoke-filled rooms, but I know that there's some there can be some conversations being had. So tell me your position in those conversations, Representative Johnson.
Well, I would tell you, I'd love to say that, we were great strategists and moving in and out, but actually it was just a perfect storm. There's so many terrible things that happened in such a short amount of time around the country, that the attention began to focus on things that symbolize this kind of hatred. And you couldn't avoid looking at the flag of the state of Mississippi. And when people outside of the state start saying, hey, this George Floyd thing is bad. This thing that happened with the jogger and I think it's Aubrey and Georgia. We just had the church shootings not too long ago in South Carolina. What's going on? And they said, well, how can you ignore it when you ignore it in the state of Mississippi when you got a flag that represents hatred, represents slavery, represents the perpetuation of terrorism on one population or a small population of people. And so it became incumbent upon us because let me tell you, people like Derrick and myself and other people, we've been introducing legislation for 10, 15 years saying, let's get rid of the flag. We knew and we know what it represents. And other people knew too. I had a white businessman tell me that he always wore his Mississippi pin when he was in the state. So whenever he got on a plane, got ready to leave, he took it off. I said, why would you take it off? He said, well, it's just not well received anywhere else. Well, if it's not well received, why do you want it to be the symbol of the state of Mississippi? So anyway, but I can just tell you when the NCAA, the SEC, football is king in the South, when they start saying no championships, baseball, no championships, the Southern Baptists came on. I'm like, hey, at that point, it became a done deal. But our responsibility, I can tell you, Derrick and my responsibility was to do exactly what Derrick talked about. That is to move around these smoke-filled rooms, count votes. We had to make sure that our people didn't want to get on a soapbox and start, giving long sermons and civil rights speeches that we had given before, but this is not the time. Let's let these people who are not inclined to make this vote find a way within themselves to do it quietly without us getting in the way. And so we had a responsibility. Look, it's hard for me to be quiet. It's hard for me to not talk about how important it is to get rid of the flag, but we managed to do that, and we managed to keep our caucuses in a place that helped us get that done. And I applaud Derrick in making sure that he every day I got a call from Derrick. What are your votes? What are you doing? Have you talked to so and so? Have you I think I got some Democrats. We actually have 2 or 3 Democrats who's saying that they'd rather put it on the ballot. And I said, oh, well, I got to call those people. And so we had all those kind of things that happen. But I think the most important thing, though, I can tell you, Vangela, that I'm continue to be hopeful for is that we got rid of the flag. But does that mean we're going to expand Medicaid? Does that mean we're going to start putting money into poor Black communities to help them create jobs? Does that mean we're gonna find a way to put money in our school systems in areas that they haven't had it before? Does getting rid of the flag, because all those things, in my opinion, is born out of racism. You don't keep people down and blame them for staying down, and you keep money from them and resources from them. That flag represented that to me. So now the flag is gone. When we go, and as Derrick talked about, when we go back in those rooms, can we now have a conversation about can you listen to me when I tell you you're not putting the kind of resources in my community that you're putting in yours? And if you want us to do as well as you're doing, want our schools be better, we need money. You need to invest in roads and in broadband and schools and hospitals and incentivize doctors and teachers to want to be there. So, I mean, it's not that kind of.
And Vangela, I like what Robert said, because I mean, I've told a lot of people, even coming back to the Delta, and they've been talking about the historic session about removing this 126-year-old flag. And I said, but let's wait now, because the flag is just a symbol. And the flag, to me, only represented the underlying conditions of a state that's not healthy. So all those things that Robert just mentioned, those the real racial inequalities that we need to address, because we unhealthy when it comes to healthcare. We unhealthy when it comes to education. The investment that Robert's talking about. Are we going to address the fact that we spend $1 billion of state public dollars, and we only spend less than 1% with Black business? I mean, are we going to talk about the fact that Mississippi has the 2nd largest incarceration rate in the world? So all of these are the real underlying conditions that we need to address if Mississippi is going to ever become healthy. And so the flag was just a symbol. It symbolized how unhealthy we are. But we got to now focus on those underlying conditions if we're going to be the state that we can become. And so I hope this bipartisanship that we are seeing at the Capitol, I hope it lasts. But like Robert has said to me many times, Derrick, the real tough conversations are about to start now. And so the same support that we've gotten across the aisle, we want that support as we move to these bigger issues that really affect Mississippi.
And I want to say this, Vangela, nobody knows it better than the Center for Justice. All these things we talk about, you deal with them every day. But I'm gonna tell you what, part of the reason we're able to work together is because of the attitude of the governor. As long as the governor continues to quote Donald Trump and say, I'm gonna follow the president, I can tell you that we'll find a way to work with each other across the aisle, because I mean, we passed a criminal justice reform bill, the governor vetoed it. We passed the education bill, the governor vetoed it. He took $6 million out of a $180 million healthcare bill. I think it's $160 million healthcare bill. $6 million for a disparity program that would have addressed issues in the health issues in the African American community. He vetoed that because he said, I don't know who these people are. They were FQHCs that have had over 100 years of experience in dealing with poor people and African Americans, and he vetoed it because he said, I don't know. That's like the president saying, I don't know John Lewis. I mean, what are you saying? As long as that attitude is pervasive in the governor's mansion, we'll find a way to work. The legislature literally unanimously passed all those bills, and the governor vetoed. So
with that, with knowing that and knowing what you're up against, as you do prepare to go back into, to address some of these issues that are definitely creating or expanding the quagmire of many of African Americans and poor people in this state, what are the litany of issues that you're going to have to grapple with, that you're going to have to address? What would you say are those that are likely to get some significant action or response when you return?
Let me tell you, I've said this, and I don't say this lightly, and I don't mean it as a rationalization of the problem. This is where the pandemic has been a blessing. When we sit down and talk about the pandemic and talk about how we're going to deal with it in healthcare, we got to talk about, hey, well, they're running out of beds in Greenville. Well, we got to send them some money to expand it. We have to do something to address that issue. See, the pandemic knows no color, no party. And so when you sit down and talk about these issues, I find that we don't have Republican and Democratic conversations about the pandemic. It's the same thing with education. When we say, well, we got to have rural, we've been saying you got to have certain things in districts, you don't have them now because they're not equally funded. Now you talk about it, you have a responsibility constitutionally to educate all kids equally. You can't do that if you don't provide the funds for every child to be able to virtually learn or find a way to go back to school and distance learn. And so in that sense, when we sit down and talk about funding education during this pandemic, and you say, well, it may not take as much money in Tupelo, but it's going to take a whole lot of money in Greenville. You got to give them the money because that school has to have whatever they have in Tupelo. You got to have it over there.
And do you actually think that is going to happen? Not only for broadband, but also to provide the resources and the instruction for the teachers, the equipment. And if it happens, when will it happen? Because
I just think what Robert is saying is when we go back, some of the things that we've been pushing for all along, the opportunity exists more now than it ever existed before. Yeah, so it's almost like where those bills never came out of committee, they fell on deaf ears. Now it's at a point where the opportunity exists. It's greater for us to try to achieve the goal now than ever before.
That's what I'm saying. I don't know if they're going to happen or not, but we're having conversations that we've never had. I'm telling you, we're having those conversations. And it's like before Briggs left, Briggs was talking about, well, we only have 6 days. We only have 6 days because people wanted to limit what we could do. We can come back and do a whole lot of work. And so we have to decide whether or not, but we are having conversations that I just talked about, Vangela, that we've never had. And so I don't know if it's going to happen, but we're at least talking about it. And Derrick is right. Bills are coming out of committee that never came out. And so that's what gives me some hope.
Right. And I tell you, I have hope. Sometimes it's been hard over the years to have hope, seeing what I see in Mississippi, but seeing that you all, the energy and the commitment that was had through this last legislative session with regards to dealing not only with the flag issue, which is important, but as Senator Simmons said, that's just a symbol. That was just the outside, if you would, when you took, that was just a scalp of the festering sore that we have in Mississippi. So I am encouraged, and in you all's leadership, in the leadership I saw across party lines, I am very encouraged, and I am encouraged not just for myself, but for the people that we represent at MCJ, because we represent the people that you
Absolutely.
all, you know, when we talk about having the deserts, not only economic deserts, but healthcare desert, education deserts in these various areas, and the people who are out there on front lines who are worried about losing their homes or losing, whether it's a mortgage or whether it's a rental, they're worried about losing those, or their utilities being disconnected by unscrupulous landlords, even during these times of pandemic. And the other issue, of course, that's very, you know, in the front of everybody's mind is just how this back to school in the midst of this pandemic is going to work, when you know that our numbers are rising, they continue to rise. And once you have the children and teachers mixing in that kind of environment, and employees, people who are cafeteria, custodial workers, bus drivers, all of this, you know, again, we have one perfect storm, but we may be sitting on the cusp of another. But I would like to thank you all so much for joining me. And as we get ready to end, I do want to hear from both of you, and wish that we could have heard Senator Hopson's vision as well. I think we heard it somewhat through the comments that he made, which also seemed to be, you know, very positive for this state. But I'd like for each of you to take about a minute. I know that might be difficult, but just a minute to tell us your vision for the future for a better Mississippi. And Senator Simmons, if you will begin.
Well, Vangela, it's not a secret that Mississippi has dark chapters in her book, and it's my hope that we could actually put those dark chapters aside and now move into some new chapters in Mississippi's history. A chapter that is bright, a chapter that is inclusive, a chapter that is progressive for all Mississippi. For a long time, and what we even saw with the flag.
So we will pivot to you, Representative Johnson.
Yes.
For a better Mississippi.
I want to echo that this has been a pleasure, and this has been almost cathartic for me to be able to talk about the issues that we have to deal with every day. But this is where I'm hopeful. I said earlier, and I mean this: the pandemic pulls the cover off of poverty. Mississippi can't hide behind some made-up numbers about what we are. We have to address issues in this state now that we hadn't addressed before. And so what I'm hopeful about is that everybody understands what a crisis we're in. And so I'm hopeful that we'll continue to work across party lines to do what's best for the people of Mississippi, and not just for big business or people who already have, but for people who don't have representation, only us. The only representation they have at the Capitol, they don't have a lobbyist. They don't have people walking around the Capitol who are being paid a bunch of money to take care of their issue. They just have us. And so what I would hope is that people began to work together to take care of the individual working man and woman in the state of Mississippi, and that we finally come together in a way that the flag has kept us separated. And I can tell you this about the flag. I think there are going to be economic and cultural opportunities that we've never had before, because that symbol is away from us. And I think the fact that we got rid of it, I think people, whether it's true or not, feel like there's a new Mississippi in front of us. And I want to believe there is, and that makes me hopeful.
Thank you, Representative Johnson, and thank you again for joining me in this inaugural conversation. And I look forward to having you back. And I know Senator Simmons is back. Senator Simmons was able to get back into our into the Zoom room, so we're going to let him. I'm going to ask him to finish to again give us your vision for a better Mississippi, and where do you see us as we enter 2021?
As we enter 2021, and what I was saying, Vangela, is that the same way we were so joyous when we actually removed or retired the Confederate flag, it's the same way I would like to see Mississippians continue to put forth policies that will represent all Mississippians, the underserved, the underrepresented, the unrepresented in Mississippi. They've been suffering for so long. And so what I like to see is for my colleagues in the legislature, I like to see legislative leaders I like to see even our state leaders, even our governor has said he want to be a governor for all Mississippians. And so I would like to see just the same coming together, if you will, that we saw when we actually got rid of that flag, that we will continue to address all of these racial inequalities exist for all Mississippians. And so I'm very hopeful, I'm very optimistic that we could be bright, inclusive, and progressive, the Mississippi that we need to be and that we have been fighting hard to be for a long time.
Thank you, Senator Simmons. And I would echo the comments, both of your comments. Particularly, I have sons, all of whom chose to go out of state to school. I would one day like to see them come back to give that energy and that education back to Mississippi. And I think as long as we keep moving forward and we have progressive leaders such as yourselves, I think I can keep that hope alive that my sons will come back and they will live in a state where they can be happy and where they will be treated fairly and equally. Again, thank you all so much. I thank my guests, Representative Robert Johnson, Senator Derrick Simmons, and Senator Briggs Hopson, who had to leave us just a little early. Thank you so much for joining me for this inaugural Conversations with Vangela Wade. I look forward to having these conversations in the future. Again, as I said, to have it with leaders such as the ones that shared this time with us today, but also with people across this state who have extraordinary stories that can help me be extraordinary stories and experiences that can help me be a better leader at the Mississippi Center for Justice, where we are standing in the gap for the most vulnerable people across our state and have done so since 2003. Again, thank you all so much, and I hope you have a wonderful day, and please keep in touch.
Thank you. Thank you so much.
Thank you.
We enjoyed it.
Thank you. We enjoyed it. Bye-bye.